Good morning. Today we are going to discuss about the drug used into the hypertension. Now, whenever we are talking about the hypertension, it is the most common cardiovascular disease and it is responsible for the in the pathogenesis of the numerous heart diseases. Now, whenever we are talking about the blood pressure, how we are calculating the blood pressure. Now, blood pressure we are calculating is CO, that is cardiac output into the peripheral vascular resistance. That means if the cardiac output is decreasing, blood pressure it will decrease. If the cardiac output increasing, blood pressure it will be decreasing. Similarly, if peripheral vascular resistance. Now, what is meant by the peripheral vascular resistance? This is the pressure you can exerted by the blood into the blood vessels. Clear? So blood vessels, that means what? That means if the blood vessels you can it is dilated, then the resistance, vascular resistance, it will be reduced, blood pressure it will be reduced. Now, whenever we are talking about the hypertension, this is you can say that the classification of the hypertension as per the sixth report of the Joint National Committee on Prevention, Detection and Evaluation and Treatment of the High Blood Pressure. Now, what is it is the JNC6 category. We are talking about that optimal blood pressure. Whenever we are talking about the optimal blood pressure, this is the systolic and diastolic. So you can say that optimal blood pressure, it is of course it is lower than the 120 by 80. So in the Gen 6 category, we are considering this is a normal. Clear? This is a normal. Next is in case of the so say this is the JNC6 category and this is the JNC7 category. So how it is changed? Now, in case of the previously it was the optimal. Now, in JNC7 it was considered as the normal. Next is normal as per the JNC6 category, that is the systolic 120 to 129 and diastolic, that is the 80 to 84. Of course, it is the mm of Hg. And borderline, clear, borderline it is considered as the 130 to 139 and 85 to 89. And nowadays it is considered as a pre-hypertensive, that means pre-hypertensive stage. Now together it was considered as a pre-hypertensive stage. Next is hypertension. Now it is more than the uh, 140 and diastolic it is more than the 90. So now also it is considered as a hypertension. But here in under the JNC 6, it was divided into the hypertension divided into the three category, and currently it is divided into the two category. Now what is the first category? In between 140 to 159, that is the systolic, and 90 to 99. So that is the stage 1, and as per the JNC 7, now also it is the stage 1. Next is stage 2 as per the JNC 6, that is the 160 to 179 systolic and diastolic, 100 to 109, and stage 3 more than 180 and more than 110. And now these two is combined, it is considered as a stage 2. So this is as the classification. Now whenever we are talking about the blood pressure now or the hypertension, now we need to understand that how it is regulating. Now how it is regulating the hypertension in our body. Now generally, say here we are a conception note we are doing, that is the venules. You can find that it is the heart, sympathetic nerves from the CNS. This is the kidney. This is the arterial resistance we are talking about. Now, this blood pressure that is depends upon the cardiac output and the peripheral resistance. It is mainly regulated. The blood pressure is mainly regulated by the two mechanisms. One is the short term, that is the we are considered against sympathetic nerve. That means sympathetic outflow. Now, that is in the sympathetic noradrenaline. Now noradrenaline outflow that is also important to regulating the blood pressure, but that is you can say that short term regulation. But here we can find that renin-angiotensin system. Now, kidney is secreting the renin, juxtaglomerular cell, and then renin it is responsible for the conversion of the angiotensin to angiotensin 1, 2, 3, and they are responsible again. They are acting on the kidney for aldosterone secretion. They may act on the blood vessels, producing the resistance, etc., etc., blood volume. So in all this case, they are regulating also the blood pressure by altering the resistance into the arterioles as well as the blood volume. So we can say that this is the long time regulation. The renin system is responsible for the long term regulation. So renin angiotensin system it is responsible for the long term, and sympathetic system it is responsible for the short term regulation. So this is about the basic of the how the blood pressure is regulating in our body. So in the next part we are going to see about the what are the drugs are there and how those drugs are affecting to controlling the hypertension.